personality and intellectual development in children. Introduction to the module. This module will expand your understanding of how psychologists observe and categorize intellectual development and the personality in children. You will learn about different personality traits, psychosocial stages, and intellectual concepts. By the end of this module, you will be able to describe intellectual and personality development, assess the process of psychosocial development in children, understand the intellectual development of children at different ages, explore differences in children's personality and temperament, explain how to encourage healthy intellectual and personality development as carers. Brain development. Brain development is the process of developing new neural connections, like wiring in the brain, thought processes, and knowledge. It depends upon both genetics and environment influences. Brain development begins in the womb and continues throughout childhood until the age of 25. It is a key part of children's development. In children's early years, this process depends on the input that the brain receives, such as verbal language or visual stimuli from carers. Lacking stimuli can impair brain development, so carers have a responsibility to stimulate, challenge and allow their children to explore. Intellectual development at different ages. As we know from Module 5, intellectual development is closely linked to cognitive development and growing intelligence. Let's look at the signs that this process is happening as it should during different ages. 0 to 6 months. Infants cry and explore the world with their senses, like touching, seeing, and sucking. These curious behaviors are signs that children are intellectually developing as they should be. 7 to 12 months. Children will start forming their first words, even if they cannot associate words with meanings yet. They might also wave goodbye and grasp the concepts of cause and effect and object permanence. Carers should be responsive and stimulatory with activities including rocking, holding, singing to, reading to, using mirrors, giving toys to children. 2 to 3 years. Children will rapidly become more intelligent during this time by playing, exploring the world, and communicating with others. At 2, children will be able to spot similarities between two objects, use basic pronouns. By 3, they should be grouping items, know who they are, and be able to imitate some adult behaviors. To promote healthy development during this time, carers should give children space to explore, provide age-appropriate toys, provide a healthy diet and secure base. 3 to 7 years. This is a fascinating time where children develop several new concepts. Concept of time. As a 3-year-old, a child understands there are past and future, but they may not be able to delineate different amounts of time clearly. For example, children may refer to everything that happened in the past as yesterday or before. As they progress, children will understand how to categorize and quantify time, with concepts like days, the past, the future, seasons, and years. They will also grasp concepts like morning, afternoon, and night. Concept of speech. The growth of vocabulary and communication skills is one of the most noticeable changes at this age. These include 3-year-olds will mostly use simple sentences. By 4, They can have conversations with adults and their peers, being able to use longer sentences and tell stories. By 7, children should be able to express themselves well and be able to understand detailed stories or instructions. Concept of reading. At age 3, a lot of children will have a favorite book that they ask carers to read repeatedly. They may have even memorized these books. It is not until age 5 that most children begin to have a grasp on how phonics works and be able to recognize simple written words. Most children will start reading by the time they are 6 to 7. For these phonological skills, the child must be able to discriminate between different sounds. Concept of reasoning. Reasoning is a person's ability to use their pre-existing knowledge to form opinions about different outcomes. This concept dramatically improves during these years. By 7, most children can use reasoning to draw accurate conclusions about many things, understand that other people have their own perspectives, understand that two things that might seem opposite can be simultaneously true, for example, small and heavy. 8 to 12 years. Children continue to develop new concepts more slowly, but these skills are necessary for adolescence. Concept of socialization. Children here experience more interest in social interactions, groups, and relationships. They develop critical social concepts: the self, fairness, ethics, justice. Concept of communication. By 8, children are quite capable of expressing themselves verbally. By 12, many are also capable of producing effective writing too. Concept of character. Despite a young age, children will already be making impactful decisions about topics like drugs and sex. Personality or character development. Personality is defined as the recognizable traits that a person has, which differentiate them from other people. Development of character. Compared with adults, children's personalities have more plasticity, that is, the ability to change or be molded easily. The development of character is the result of a combination of an individual's inherited, genetic, structure and their environment. Environment aspects include socio-cultural factors, socio-economic factors, education, public guidance, physical well-being. Implicit or hidden aspects include biological factors, sex, genetic temperament differences, parental education, emotional well-being. Psychoanalysis. Psychoanalysis is a method of therapy centered on analyzing psychic phenomena and treating emotional disorders through sessions where the patient is encouraged to talk freely about personal experiences, especially about early childhood and dreams. Essentially, psychoanalysis is about releasing repressed emotions or experiences, bringing unconscious conflicts into the conscious mind for treatment by specific techniques, for example, dream interpretation or free association. Freud's psychoanalytic concept. Sigmund Freud founded the school of psychological thought and practice. He was primarily interested in character development from a sex-related and emotional perspective. Customization of psychoanalytic concept. Erik Erikson and Stack Sullivan further developed and customized the concept of psychoanalytic development. They summarized the significance of social interactions using a life cycle split into 8 stages of psychosocial growth. Each stage has particular developing projects, which Erickson and Sullivan termed a psychosocial crisis. These stages are as follows: infancy, toddler, preschool, school age, puberty, young maturity, middle years, old age. With this in mind, let's examine the childhood stages individually. Erickson and Sullivan's stages of psychosocial growth. Infancy stage, 0 to 1 years. During this stage, infants undergo rapid physical, psychological and social changes. This stage is the root of personality development in the future. The developing projects at this stage are learning, walking, talking, developing relationships with others, establishing emotional relationships with primary medical service suppliers, eating, creating routines. Toddler stage, 1 to 3 years. Toddlers want to explore the world, but parents need to place limits on their behavior. The central conflict is between autonomy and restriction. The developing projects for the toddler stage are as follows: longer-term separation from caregivers, gaining control of bodily functions, for example potty training, using words to communicate, becoming less dependent on care providers. In Erickson's theory, parental restrictions in the toddler stage can cause the following results. Negativism. This describes the negative feelings brought about by having autonomy limited. Children will continuously hear and use the word no. Frustration. This is typical because children are increasingly curious and better able to explore the world around them, but their ability to comprehend it may lag far behind. Children become increasingly aware of the limits that carers place upon them and the need to behave appropriately to keep them happy. Anxiety. Because children realize they are a separate self or person as a toddler, they become aware that they cannot provide for themselves, which can cause anxiety. Preschool or early childhood stage, 3 to 6 years. This stage is characterized by increasing language and communication. Imagination and play are crucial at this stage. Children have more independence, but they are still wholly dependent on their caregivers and continue to require high levels of care and support. Development projects for preschoolers. For the preschool stage, developing projects are about improving the capacity to connect with and understand other people, including self-care, understanding sexual different, modesty behaviors, moral understanding, rules, right from wrong, creating family relationships. School age stage, 6 to 12 years. Regular schooling transforms children's lives. At this time, children's responsibilities, self-perception and intellectual capacity change. Comparisons with peers. This stage is critical because children begin to compare themselves with their peers. They thus learn how to place themselves within groups of people. Ascribed status to achieved status. Ascribed status is the status of something from its birth or inception. By contrast, achieved status is something that needs to be earned. When entering regular schooling, children go from this ascribed to achieved status. They need to learn to be a part of the group and to make themselves stand out, too. Feelings of liability or responsibility. These children understand that they should try to fulfill their potential and behave responsibly. Sense of belonging. This is about the feeling of identification with a group. At school, most children come to feel accepted by a particular group and follow its principles and values. Morality. At school age, children come to develop a sense of right or wrong. Into adulthood, there are 3 further stages: young maturity, middle years, and old age. Adolescent stage or puberty, 13 to 19. Adolescence is a time of rapid physical, psychosocial and sociological growth. Developing projects during this stage are identified by body or appearance, creating proper connections with peers, recognizing age-appropriate gender-based roles, becoming independent, developing morality, changes in behavior, adopting principles needed for performing tasks in society. Period of revolt. With the changes that are happening in their bodies and with social expectations, adolescence is a difficult time of adaptation and emotional turbulence which can make the parent-child relationship problematic. A central conflict exists between dependence on their parents or carer and the need for independence. The role socialization versus temperament. Process of personality development. As we know from Module 6, modern psychologists approach the mind as a complex combination of influences from nature and nurture. The personality is no different. As a child develops their personality, mutually informing internal and external factors shape how they come to have their unique collection of personality traits. In short, a cyclical process takes place. A child's temperament informs their behavior, which then affects their environment. This, in turn, affects their self-concept or temperament and ripples into future behavior, restarting the cycle. Socialization and the self-concept, nurture. A child's self-concept is progressively altered in response to the people surrounding them. For example, if a child faces rejection from their peers, he may experience loneliness and avoid further social interactions. Temperament, nature. Children's behavior is partly dependent on their genetics, as this predetermines certain aspects of their temperament. Before much environmental influence on development in infancy, children already have distinct personalities. Some are calm, others may be fussy. For example, boys are generally more aggressive, or certain children are born with a predisposition to addictive behavior patterns. The role of parents' motivation. As we know, parents or other primary caregivers play the most fundamental role in shaping who children become. A critical part of providing positive parenting is to observe children and make assessments about that child's character or personality. Accordingly, this allows parents to make the best decisions for their children's development. For example, imagine a parent notices that child is arrogant and boastful. To combat this behavior, the parent might introduce the child to media role models known for their modesty. Alternatively, they might read them stories about children who are too arrogant and have problems because of it. So, parents need to get a good grasp of their children's personality traits. Temperament or personality traits. Personality traits are distinguishing features of your personality. There are 2 categories: cardinal or central traits. Traits that dominate your personality and life, they are how people understand who you are. Secondary or peripheral traits. traits that only appear under particular conditions, for example interview nerves. According to psychologists today, there are 5 major traits that underlie personality. Openness. People who like learning new things and new experiences, insightful, imaginative, curious. Conscientiousness. The quality of wishing to do what you do well, reliability, promptness, thorough, methodical. Extroversion. This about the extent to which people enjoy interacting with other people, extrovert versus introvert. Agreeableness. The quality of being friendly and pleasant, affectionate, sympathetic. Neuroticism. This is about emotional stability and intensity of negative emotions, moody, tense. Types of personalities. Carl Rogers theorized 2 types of personality: an ideal self and an actual self. The higher the level of congruence between these 2 ideas, the more self-worth and positive qualities a person is likely to have. Rogers posited that all humans have a single underlying motive: to self-actualize, to fulfill your potential. Self-actualized persons have 5 characteristics. Openness. Existential living. In touch with the present, unprejudiced. Trust. In the self to make good decisions. Creativity. Problem-centered, not self-centered. Rogers suggested that a child's environment needs to have the following conditions for a person to reach their potential: genuineness, authenticity and realness. Acceptance, non-judgmental, received positively. Empathy, being heard and understood. Types of children. Flexible children. More efficient in most activities, polite, happy, follow regular routines. Adapt effectively to change and are not easily upset. Parents of flexible children will have fewer struggles but need to provide love, warmth, and necessities to ensure healthy development. Difficult children. These children may be hard to please, have intense reactions and irregular daily routines. Carers of difficult children need to provide enough space for play and guidance to keep routines and emotions manageable. Slow children. These children tend to be lazy, selective, and fussy. These children often lack motivation to play or study. Parents must provide positive reinforcement and continuous positive modeling. Parents need to provide many opportunities for activities that encourage enjoyment and independence. Parents' temperament and personality development. The judgment of personality traits. Parents do not just need to be aware of what temperament their child has, they need to be mindful of their own character. Mothers and child's first learning. Mothers are typically the first role model for their babies, and they learn their first behaviors through them. This means mothers must be especially conscious of how they behave. Essentially, how carers behave shapes a child because they keenly observe and model others. Children may not be able to distinguish between right or wrong, which can result in learning undesirable behaviors. Effects of names on personality. Even the seemingly trivial choice that parents make can influence how their children develop. Some psychologists suggest that a parent's choice of name can affect personality development. With these understandings, parents should keep the following considerations in mind when dealing with children, especially babies. Appreciate the uniqueness of children. Parents should not compare their children to others, it may damage their self-confidence. Communication. Ensure parents know a child's needs and problems. Role model. All children copy their parents, so parents should be honest, politely and clearly communicate, and follow healthy behaviors and routines. Enjoy time with their children. Parents should get involved with children's activities and games. True guidance. If a baby is struggling with something, the parents should try to let them persevere. Socialization. Parents should encourage their children into social situations. Anxiety response. With sensitive children, toys or other objects should be used to ease separation anxiety. Reasons and results of childhood trauma. As we discussed in Module 3, trauma can alter children's brains, personality and cause developmental issues. Trauma might be a sudden or ongoing event, like a state of constant deprival. The results of trauma can be short and long-term. They include feelings of sadness, loneliness, anger, shame, guilt, a lingering fear of future trauma, distrustfulness, confusion and difficulty concentrating, learned helplessness, perceived lack of control. Summary. In this module, you have learned to describe brain development, to explain intellectual development and how it progresses over time, to categorize and identify different personality traits and types in children, to describe Erickson and Sullivan's theory of personality, to identify different influences on personality development, how individual and parental temperaments influence development,